Hey everybody, the BBC has been making a big fuss about the cost of sickness in the UK. But all the noise is about the amount of money the government is spending on sickness benefits. What about the suffering caused to sick people themselves? Read the BBC's article about it, and you should be sickened yourself. It says, the number of sick and disabled people out of work is putting the UK at risk of an economic inactivity crisis that threatens the country's prosperity, according to a new report. There were 800,000 more people out of work now than in 2019 due to health conditions, costing employers £85 billion a year, according to the review by former John Lewis boss Sir Charlie Mayfield. 1 in 5 working-age people were out of work and not seeking work, according to the report, which was commissioned by the Department for Work and Pensions, but produced independently. Without intervention, another 600,000 people could leave work due to health reasons by the end of the decade. Illness-related inactivity costs the UK economy £212 billion annually, by some estimates, or nearly 70% of income tax, through lost output, increased welfare payments, and additional burdens on the NHS. What kind of intervention does the BBC mean? Inevitably, it is intervention to stop sick people getting the help they need. Sir Charlie will lead a task force aimed at helping people return to work. Work is generally good for health and health is good for work, he told BBC Breakfast. For employers, sickness and staff turnover bring disruption, cost, and lost experience, he said. For the country, it means weaker growth, higher welfare spending, and greater pressure on the NHS. People could be encouraged to stay in work if health is viewed as a shared responsibility between employers, employees, and health services, he said. Sir Charlie added his task force would work with GPs who say they find it difficult to judge whether or not a person is suitable to work while they are ill, but are asked to issue sick notes by patients. So, the intention is to force people to stay in work despite their illnesses, and to force GPs to deny them the sick notes they need to justify benefit payments. We can see this in the behaviour of panellists Sarah Smith, Neil Shastri-Hurst and Marcus Ryder on the BBC's Politics Live on November 5th, 2025.
Sarah, whose responsibility is it to help get people back to work?
But we need to address this crisis. It is a massive blocker on growth in this country and in productivity. There are far too many people who could be in work who aren't in work. I think getting back to face-to-face assessments, for example, would help tackle a lot of those problems. But it's also recognising a lot of these cases are those individuals who are suffering from mental health issues. Now, we've got to separate between mental health well-being and mental health. They are two separate things. There are the ups and downs of life that we all have to face, the stresses and strains of it, and too many people have fallen out of work because of that, who should be back in work, particularly amongst the younger generation.
Imagine Meg from Newport says it's about time they started to look at the sickness in this country. There are so many people who use it when they can't get their own way or have a warning in work, and this makes it bad for genuine people who are genuinely sick.
During COVID, we saw a particularly significant uptick in the number of sick notes being issued, and so that does have to be looked at. About now 1 in 8 young people who end up not in employment, education and training. The government is looking at the youth guarantee, making sure every young person has that guaranteed working or earning or learning opportunity, but also linked into that, if they don't take that up, that some young people will lose access that they can get to benefits, in order to make sure there isn't that sort of assumed line that they'll just fall into that pattern of worklessness. And I think that sort of policy is really, really needed as well to tackle it.
It would be fine if we could trust the UK government to run a system that acknowledged genuine illness. But more than 100,000 dead benefit claimants between 2011 and 2019 are ample evidence that governments are more concerned with saving money than helping people. Remember, this is a crisis that was created by politicians. The Tories either cut the NHS or privatised it, making it harder to cure, let alone prevent, conditions that should not have been allowed to become huge problems. The COVID-19 lockdowns caused serious mental health issues for many people, especially school-aged children, many of whom are now struggling in the workplace. And long COVID has crippled many people, possibly for life. These are just the headline issues, but considering all of them, it is morally wrong to discuss this issue simply as a financial problem. Framing that calls rising sickness absence a financial burden is incomplete and misleading. Here's why. Cuts to NHS funding, long waiting lists and partial privatisation over the past decade have made timely treatment harder, meaning preventable or manageable conditions worsen. Chronic underinvestment in mental health services and social care has left many without support, pushing them out of the workforce unnecessarily. COVID-19 lockdowns, school closures and social isolation triggered widespread mental health issues, especially among young people now entering the workforce. Long COVID has left a significant number of people with long-term disability, a condition beyond anyone's personal responsibility and not something a simple workplace intervention can fix. The BBC article emphasises individual and employer responsibility. Work is good for health. But structural problems, underfunded healthcare, poor workplace protections, social inequality are the real drivers. Treating this purely as a financial problem risks blaming individuals for circumstances beyond their control and ignoring the need for systemic investment. Reducing sickness and disability to a cost figure, £85 billion, frames human suffering in purely economic terms, which is ethically problematic. People are not line items. Their struggles often result from policy failures, not personal failings. While productivity and economic impacts are relevant for policy discussion, the narrative should always include causes, social context, and long-term care needs, rather than reducing it to a financial burden. Otherwise, it implicitly shifts responsibility from the governments and institutions who are actually responsible for the problem onto sick or disabled people themselves. Don't let that happen.